Do you have neck pain or headaches? Have you been to a chiropractor? Have you been to a physical therapist? Have you maybe had an injection or massage and some other therapy that just doesn't seem to work? Well, it may not be from your neck. If everybody's staring at your neck, maybe it's not there. So unless you specifically had an injury to your neck, and we all know what those are, it's a possible car accident, or you actually hit your head and then you ended up with head, neck, and pain. There are other reasons that this can happen. It could be a fall. It could be improperly sitting. You might have a chair that doesn't work right. Maybe you have a bed that's bad or a recliner that's affecting how your body works. Or even injuries, something from your pelvis. So you might have fallen at some point right onto your buttocks and said, okay, I hurt down there, but never thought that that could affect how your neck works. Well, if you think in a car wreck, you get hit from behind, but nobody ever really hits their neck. The body gets pushed forward and the neck ends up in a whiplash position. When we fall, the same thing can occur. Then we end up with a whiplash injury, but nobody's taking a look at what the cause is. So the nervous system works by, you could have an injury to your hand, and that hand keeps sending a signal up to the neck, or maybe you were, throwing the ball around, or you fell and you put your arm out and you hurt your shoulder, and that shoulder is now putting signal up to your neck and again and again and again, but it's not getting fixed. But nobody's taking a look at those external possibilities, and so your neck continues to degrade and cause pain and cause headaches. The other thing that comes up to the neck is blood supply. It's going against gravity. Remember, the heart has to pump and it has to go up. So could there be a blood supply problem? Could there be a blood sugar handling problem that is allowing the blood supply problem to come because it needs to have its nutrition? So your doctor needs to be looking at all those possibilities. And at Trites Clinic, we address these conditions because we sit down and we talk to you for an hour. I want to see your history. I want to see your work. I want to see what you've done. I want to see where you've gone, to make sure that those things can be ruled out, so we can come up with a treatment protocol after we run our testing to make sure that you don't have a blood supply or a blood sugar handling problem or an external injury that's not being addressed that's affecting the nerve to your head and causing you head pain, neck pain, and headaches. And that's what you're going to get. And then we'll sit down with a one-on-one and find out what's the best form of treatment. Is it going to be exercise? Are we going to get in there and fix a muscle? Or are we going to address a joint that's further on? Maybe you have a nutritional deficiency that's causing inflammation and swelling into your neck. And so we create that for you. And so we create that treatment protocol for you so you can get back to your life the way you deserve to be. So we sit down in that one-on-one and decide what is the best treatment protocol for you so you can get back to what your life is and how you want to live it. I'm Dr. Trites' Trites Clinic. Be well.